Hi everyone, this is Aurelie Najm reporting from Vienna live at Eular 2024 for Now. I really am excited to be with you today, and I wanted to share with you some abstract that really did catch my attention. It's about psoriatic arthritis, and it's about what we call the window of opportunity, and that's something that we know very well in rheumatoid arthritis, but haven't been studied so well in PsA. And so it's OP0184, and it's the GALME PsA trial. So this was a randomized controlled trial that was looking in very early psoriatic arthritic disease because people had duration of less than 2 years and they were naive completely of any drug, including conventional synthetic DMARDs. And so there were two strategies there. One was methotrexate plus glucocorticoids, and the glucocorticoids, they were delivered the way we deliver them in the UK, which is not with tablets. It's usually intramuscular injection. And in this case, it was 120 milligram, which is quite a high dose. And that was this versus methotrexate plus corticocorticoids delivered the same ways and golimumab, so a TNF inhibitor. And so the primary outcome there was the difference in the PsA score at week 24, but the study went up to 52 weeks, and they looked into 84 patients in total, divided in these two groups. And so I found the results quite interesting. Um, so at week 24, the mean difference in the PsA was 0.55, minus 0.55, which is not massive. And the p-value was not significant, but it was 0.06, which is quite close to significance. Yeah, that's week 24. Now, when they looked at week 52, couldn't see any difference. ACR 20 was really similar between two groups. There's one thing though that was different between the two groups. It's the amount of steroid that the patients did receive through the study. And in fact, patients that were in the placebo arm rather than the golimumab arm did receive much more steroid. And that's probably one of the reasons why they've been doing so well. And the median dose actually was double and the placebo group, which means 240 milligram, which if you think about it, over the course of a year is not a massive amount either. It's two intramuscular injections. There was no difference in the number of patients that needed other biologics later, and there's also no major serious adverse events throughout the study. But what is kind of interesting, I think, there's a few things there. First of all, this is very tight control strategy through a trial. This is not usually what we see in real life. If you look into it, the number of people that needed biologic in both groups after 1 year was like 3 patients and 5 patients, which is a really low number. And so I wonder if it's just the tight control of, seeing the patients very often and giving them steroids and so on. But the other thing that it's telling us is that as opposed to rheumatoid arthritis, in which, it's really clear that combination of biologic very early can allow to reach remission faster and in a more sustained way. There is evidence for that, although we don't treat every patient like that because it's not necessarily justified. We don't seem to see that in PsA, which tells us something about mechanism of action of the drugs, but also importantly about maybe how the disease works and how different it is. The other thing we need to keep in mind is obviously PsA is a much more complex disease when it comes to this is activity assessment, and this cohort was a bit heterogeneous. There were some patients with enthesial disease, some patients with more swollen joints, less swollen joints, and that's something that might have contributed to that result. In any case, I will catch up with you later to report more data. Follow me on Twitter at Aurelie Romo. Follow Rome now for more content, and don't miss our daily live panel at 6 p.m. every day. See you later.